I study a microorganism called Fusobacterium nucleatum. Around half of people with colon cancer have this organism living in their tumors. We are interested in looking at why Fusobacterium colonizes these cancers and what might predict its colonization.
I study the kinds of cells that make up your skin or make up your gut. These cells are super important because they make up like walls, barriers that keep bad things out. They keep bacteria out. They keep your digestive juices inside so they don't get into your body.
KRAS G12D, which is a subject or the protein target I'm studying on, is one of the most frequently mutated oncogene in colorectal cancer, and there is no targeted therapies available at this moment approved by US FDA to treat KRAS G12D driven colorectal cancer.
I'm working in some endogenous viruses. These sequences, these endogenous retroviruses, are being overexpressed in some colorectal cancer. These sequences can become like biomarkers for early stages of cancer disease, specifically colorectal cancer.
My research is related to the disease called inflammatory bowel disease. In this disease, it's known that there is a huge disruption of the lymphatic structure. My study tries to characterize how the disrupted lymphatic structure might affect the other cell types in the hope of understanding how we can manipulate or change this diseased state to derive insights to treat the colorectal cancer.
What I have done is that I have developed a set of chemical compounds that will be able to selectively inhibit KRAS G12D in cells. At the same time, it's not going to touch any of the healthy cells with their essential gene for normal cell growth and proliferation. By developing this kind of chemical compounds, we will potentially be able to extend the current treatable colorectal cancer by at least 14%.
I'm trying to study these sequences that are inserted in our genome. There are some papers showing that these sequences can become like possible targets for immunotherapies.
We know that the microbiome influences the immune landscape of cancer pretty significantly. And so that's one reason to study the microbiome. Many of the colorectal cancers that bacteria tend to colonize are actually the most likely to respond to these new immunotherapies.
If we just using one single approach, probably you will be able to inhibit a disease-related function, but at the same time, functions 2, 3, 4 will come up. And how would you be able to target this kind of complexity? You need people who have bold ideas that will be able to, for example, build mathematical models for this kind of complex system.
Damon Runyon is one of the very few foundations that is funding also basic research. So I think that it's like opened a lot of possibilities for us to study different fields and some topics that are really exciting.
We find really cool things in basic biology, and we don't necessarily know yet how they're going to impact human health. Being able to actually explore that space, knowing that we have that support is, I think, a really great way to actually kind of build up that body of knowledge.
Every person's cancer is different, and so it's going to take a lot of different creative strategies to target and treat this disease. We don't necessarily know whether exploring some arcane microorganism or looking at fish evolution is going to lead to the next cure, but these kind of basic science, these risky science approaches do often pay off in surprising ways. And so really every avenue is worth exploring for cancer patients.